Right, hi, my name's Andy. I'm going to be evaluating your 12 cranial nerves today. Is that okay?
Yes.
Wonderful. I've already washed my hands, so we're ready to go. The first cranial nerve that we're going to be testing is cranial nerve 1, which is the olfactory nerve. We're going to be testing your sense of smell. So go ahead and close your eyes for me. And can you close with your finger the left nostril? Perfect. And tell me what you smell.
Coffee.
Good. And cover the other side. And what do you smell?
Coffee.
Wonderful. And did you have the same strength of smell on both sides of your nose?
Yes.
Wonderful. So in the event that she was not able to distinguish the smell of coffee, or if it was asymmetrical on either side, that would be an abnormal result. Next, we're going to be testing cranial nerve 2, which is the optic nerve. We're going to be doing 5 different tests to evaluate the optic nerve. And the first thing we're going to do is test your vision. So I'm going to give this to you, ask you to cover your left eye for me. And looking out there, what is the smallest line that you can read?
HCZDVA.
Wonderful. Cover your other eye. And now smallest line?
HCZDVA.
Wonderful. So she's 20/20. You can keep that with both eyes. And that's a typical result. Next, we're going to be testing your color vision. So go and cover your left eye for me again. I'm just going to ask you to tell me what shapes you see in here.
Circle X. X triangle. Circle. Nothing.
Perfect. Keep on going.
Circle X. Circle triangle. Triangle X. Circle and a triangle.
Good.
Circle. X.
Perfect. Cover your other eye for me. And now
X. Circle. Circle X. X triangle. Circle triangle. Circle X.
Wonderful. And I'll take that back. So she got 6 out of 6 right for the color vision. So that's a normal result. Anything less than 6 out of 6 on both eyes would be an abnormal result. Take that back. Cover your left eye. Now we're going to check your visual fields. And so what I want you to do is look right here at my open eye. I'm going to hold up some fingers. You tell me how many fingers I'm holding up, but you just keep looking right here.
1, 2, 5, 1.
Add them together.
3,
And
3.
perfect. Switch eyes for me. I want you to look right here for me.
5, 1, 1, 2,
Good. Add them together.
6,
And
5, or 6,
good. Try again.
4.
Good. All right. I'll take it back. So convertation fields were full to finger count with both eyes. Anything less than full finger count would be an abnormal result. Next, we're going to be checking fundoscopy. So you're going to be looking at the patient's optic nerve. I would like you to look right up here for me. I'm going to be getting really close to you and looking at your optic nerve. Just hanging there. Good. Optic nerve is round, pink, and the margins are distinct. Keep looking right at the same spot for me. Good. Optic nerve is round, pink, and distinct with distinct margins in both eyes. So in the event that the optic nerve was pale or that it had blurred margins, that would be an abnormal result. Next, we're going to be checking your pupils and checking the response of them to light. So I'd like you to look right out at the large B out there. I'm just going to be shining some light in your eyes. Just try to keep your eyes open for me. You can blink normally though. So the right eye has a positive direct response, and the left eye has a positive consensual response. Left eye has a positive direct response. Right eye positive consensual response. Now we're going to do the swinging flashlight test. Keep looking out there for me. Good, so there's a negative APD in both eyes. So that would be pupils were equal, round, reactive to light, which is the normal response. Next, we're going to be testing cranial nerves 3, 4, and 6, which is the oculomotor, the trochlear, and abducens nerve. We're going to test this by doing checking your extraocular muscles with the flashlight. So what I'd like you to do is try to keep your head still for me and follow my light with just your eyes. If at any point you experience any pain or double vision, let me know, okay? Good. So So she was full range of motion. And did you experience any pain or double vision throughout that test? Wonderful. So the event that she did experience pain or double vision, or one of the muscles were restricted in either eye, that would be an abnormal result. Next, we're going to test cranial nerve 5, which is the trigeminal nerve, and we're going to be testing all 3 divisions, the ophthalmic, maxillary, and mandibular nerves, or branches. So what I'm going to be using is this paper clip, and we're going to be using the dull side and the sharp side of the paper clip. I'm going to ask you to close your eyes for me and let me know when you feel the dull sensation.
There.
Mm-hmm.
There. 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 There.
Wonderful. Let me know when you feel the sharp sensation.
There. 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 There.
Wonderful. Now we're going to be testing the corneal reflex. We're going to be using this cotton wisp, and I just want you to blink whenever you feel the sensation. I'm going to just touch your cornea. I just want you to look straight ahead for me, okay? Good. Keep looking straight ahead. Good. So did the sensation feel any stronger on either side of each eye? Wonderful. So in the event that there was asymmetry in the sensation of the reflex, that would be an abnormal response. Next, we're going to check the motor supply of cranial nerve 5. So I'm going to observe the masseter and temporal muscles. So I'm going to place my hands on the side of your face, and if you would, please clench your teeth for me. Good, and clench your teeth for me. Perfect. So I felt equal innervation to both sides of the masseter and temporal muscles as she clenched her teeth. There is no asymmetry. And next we're going to check the pterygoid muscles. So I'm going to place my hand underneath your chin and ask you to try to open your mouth for me. Good, and push up against it. Perfect. And so she was able to resist my hand, and so in the event that she would not be able to resist my hand, that would be an abnormal result. Next, we're going to check the jaw jerk reflex. So I'm going to use the reflex hammer. I'm going to place my finger on your chin. If you hold your mouth open just slightly, and just keep looking straight. Good. And so we saw minimal reflex. In the event that the jaw closed during the test, that would be a abnormal result. Next, we're going to be checking cranial nerve 7, which is the facial nerve. And this nerve supplies the motor branches to the facial expressions, the muscles of the facial expressions. So I'm just going to have you do a few things for me for this test. So if you would just raise your eyebrow and try to crease your forehead muscles. Wonderful. It's symmetrical on both sides. Next, I'd like you to try to close your eyes for me, and I'm going to try to open them. You just try to fight me. Try to keep them open. Good. And so she was able to keep both eyes closed, and there's no asymmetry. Next, can you puff out both your cheeks for me? Wonderful. And show me your teeth now. Good. And so both of those showed symmetry on both sides, which is a normal result. Next, we're going to check cranial nerve 8, which is a vestibulocochlear nerve. We're going to be doing 2 tests for this. It's the Rene test and the Weber test. So I'm going to be, excuse me, I'm going to be using this tuning fork and placing it in different areas around both of your ears. And I want you to let me know when it sounds louder to you. I'm going to put it in the first position and the second position. You tell me which one is louder. So here's the first position. Here's the second position. Second. Good. Do the same thing on this side. Here's the first position. And the second position. Good. So a normal response would be what she said, that it is louder typically in the second position. Next we're going to be doing the Weber test. I'm going to place this right at the middle of your forehead. And I want you to let me know, does it sound louder on either side of your ears?
No, it's not the same.
Good. So that is a normal response. In the event that she heard it louder on one side than the other, that would be an abnormal result for the Weber test. Next, we're going to check cranial nerves 9 and 10, which is the glossopharyngeal nerve and the vagus nerve. We're testing these together. And these mediate the sensory and the motor functions of the pharynx, larynx, and palate. And so what I'd like you to do is say the letters A-E-I-O-U for me.
A-E-I-O-U.
Perfect. So she was easily able to pronounce all those letters, and she did not have any hoarseness in her voice. So those are all normal results. Next, can you swallow for me? Good. Did you have any difficulty swallowing? Good. So that's also a normal response. In the event that she was not able to easily swallow, that would be an abnormal result. Next, I'm going to observe the patient's uvula. So I'd like you to open your mouth for me. Good, and say ah for me.
Ah.
Good. And so the uvula lies centrally within her throat, and so that is a normal response. In the event that the uvula deviated to either side, that would be an abnormal result. Next, we're going to check the cranial nerve letter, which is a spinal accessory nerve. Which supplies the sternocleidomastoid and the trapezius muscles. So first, for the sternocleidomastoid, I'm going to place my hand on your left cheek. I'd like you to push against it for me. Good. And now push against this side. Good. You can see both of her sternocleidomastoids contracting equally throughout the test, and the resistance on both sides was equal as well, which is a normal response. Next, we're going to be evaluating the trapezius muscles. I'm going to place my hands on your shoulder. Is that okay? All right, and try to shrug your shoulders and push against my hands. Perfect. So on both sides, she was able to provide equal resistance. In the event that there would be asymmetry of the resistance, that would be an abnormal response. Lastly, we're going to check the hypoglossal nerve, which is cranial nerve 12. This gives motor supply to the muscles of the tongue. So can you stick your tongue out for me? Wonderful. So I was looking for any signs of wasting away of the tongue or fasciculations, which there were none, and it did not deviate to either side. In the event that there was wasting away or it deviated to one side, that would be an abnormal response for the hypoglossal nerve. All right, that concludes my cranial nerve evaluation. Thank you very much, Laura.